Happy holidays, Professor Lockett. This is Tasha Unrein-Gores doing the physical assessment, Unit 6 for the lungs and thorax inspection of the thoracic cage. It is symmetrical, anterior posterior to transverse ratio is a good 1:2. There's no ribs or deviation in the spine. There's no ribs sticking out. No lumps and bumps and no tenderness. The skin color is appropriate for his genetic background. His lips are a little bit darker than his skin, which is normal. His nail beds have good capillary refill and are free of cyanosis or pallor, as are his lips. The condition is intact. There's no lesions, no clubbing of those fingers. Person's position, he's comfortable setting up straight, not bending over in that tripod position like COPDers. Facial expressions are normal, laxed, no tension or strain with any activities. Level of consciousness is alert and oriented and cooperative. Drowsiness would indicate a need for further neuro assessment. So palpation, checking for equal expansion. I'm going to go ahead and have you face that way. So in the back, we put our hands together and pinch a small piece of skin. And Howard, you're going to take a big breath in, and my hands come out and go back evenly and symmetrical. And then you do that in the front. You do more at the bottom of the ribs with your thumbs pointing towards the xiphoid process, but not pushing on the xiphoid process at all. But you don't get the skin up front like you do in the back. And so with big breath in, the hands should kind of fillet out and come back in, and that's even and symmetrical in the front as well. So we do that tactile firmitus, I think I'm saying it right. And so, sir, you're going to say blue moon. We're looking for the resonance from that vibration, from that vocal origin for the vibration through the chest cavity. So he's going to say blue moon. You could also say 99, but we're going to go with blue moon. And go ahead, sir.
Blue moon.
And you use the palm of your hand when you can hear it, or the heel, I should say.
Blue moon. 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 Blue moon.
All right. And then up front, you do the same thing. Again.
Blue moon. 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 Blue moon.
All right. And I can feel that vibration all the way down to, it feels like almost past his diaphragm, actually. And then checking to see. So then we go on to percussion. Percussing the lung fields, we're looking for resonance over that. If you have hyperresonance, it could be hyperinflated, and dullness could be indicative of pneumonia or some sort of infectious or congestive problem going on. So I'm going to go ahead and just percuss down here, and I'm listening again for that resonance that the lungs should be giving us. And 3 on each side up here. A total of 9 going down, percussing as Miss Jarvis, the doctor, whoever, whatever her title is, tells us to in our textbook. And he does have nice resonance all the way down, no dullness noted on that part. And then estimating the diaphragmatic excursion, if it's correct, we're going to auscultate down from that bottom of the scapula here until we hear that resonance change to dull. And we're going to mark that. And then you're going to do the same thing, kind of coming up, feeling the difference from the visceral cavity to that dull diaphragm. I'm just going to go ahead and measure one side at a time as I'm doing it. So in centimeters, he has a 5.5 centimeter diaphragm on the left side and the right side. Should I start a little bit lower, but starting here. You can hear that there. I'm going to mark it. Come up from the bottom. Right there. And then we're going to go ahead and mark that as well, or measure it, I should say. And we are right at 5, just over 5, but not 5.5 or 5 1/4 yet. So that is normal, and anything between 3 and 4, or 3 to 5 centimeters is considered normal. With him being even muscular, he could have been normal at 7 to 8, just depending. And then auscultation, we're listening for any adventitious sounds, which would be wheezing, stridor, that can come with asthma, any rales, crackles. Diminished sounds can be expected in older patients or patients that have, again, like pneumonia or anything like that. So I'm going to listen to him posteriorly first, and then I'll do the anterior listening. So big breaths in and out through your mouth, sir. And it's going to be a good 9 times, 2 sets of 9 times. So if you get lightheaded, just let me know and we can stop and let you catch your breath.
Okay.
All right? So big breaths in and out. Beautiful. Two more, sir. One last one. There we go. Those lungs are clear to auscultation, not diminished. You can hear the good airflow. Are you feeling shorter breath at all? Perfect. I'm going to do the same with this front. If you have enough breath, if not, just let me know. Hold up a hand or something since I have my ears in. All right? Big breaths in and out. Alright, and we know that with men with hairy chests, you need to push harder so that you eliminate that rubbing underneath the stethoscope from their hair, or also getting it wet beforehand can help as well. Lungs are clear. It was hard for me not to stop and listen to the heart there, but that concludes my lung and thorax assessment for Unit 6. Happy holidays, Professor Lockett, and we'll see you in 2015.